I thank the witnesses for your testimony here today, and I just listening to the gentleman from New York about the same hoops to buy a firearm as there is to get an abortion. I'd suggest instead in this city, for example, it's probably much easier to get an abortion than it is to buy a gun or to possess one or to transport one. And that's true also in many cities, including Chicago, for example, where we've seen a lot of death and desecration that comes from violence there that doesn't seem to be troubling the minority party either. But I'm looking through your testimony, Ms. Fredrickson, and I noticed there that in your testimony you say that you list the numbers of life-saving breast exams, the number of women whose cancer was detected early, 500,000 exams, 88,000 women whose cancer was detected early. Very likely did save lives in doing that. I didn't notice, it also that it had prevented an estimated 516,000 unintended pregnancies and 217,000 abortions every year. I hadn't seen Planned Parenthood produce a number that actually took credit for the number of abortions prevented, or excuse me, the number of abortions prevented. Neither did I see in this testimony the number of abortions that Planned Parenthood does in a normal year. Could you tell me what that number would be?
I believe the number is about 350,000 per year.
And what would the typical price be for a typical abortion?
I do not know. I do not work for Planned Parenthood.
And could I just then state, I will, off of their website, $1,500. And when I punched that through my calculator, it was 340,000 was the number I used rather than 350, but we're in the ballpark. And at $1,500 each, that turned out to be $510 million. And $510 million happens to be very close to identical to the exact number of the appropriations that would go into Planned Parenthood should the appropriations go forward, which it has out of this House at least for a couple of months. And it's hard for me to accept the idea that this is a nonprofit organization, and I would turn to Ms. Thayer. And your testimony spoke to that. Seeing those kind of numbers, Ms. Thayer, could you be convinced that Planned Parenthood is nonprofit?
Officially, Planned Parenthood is a nonprofit, but their main concern is really their bottom line. We would have monthly managers meetings via the very webcam system that they installed to do the abortions. And on a spreadsheet, they would have our goals, our quotas for every single service and supply that we had. If we met our goal, that square would be green. If we were 5% below, it would be yellow. And if we were 10% below our quota, it would be red. And we would have to have a corrective action plan on how to correct that. And abortion was one of those items. If we didn't do abortions at that center, then we had a goal for abortion referrals.
Could you say clearly here in your testimony with confidence that in your years working for Planned Parenthood that even though Planned Parenthood is filed as a nonprofit, that they are profit driven?
Well, they are all about the profit. For example, they purchase birth control pills for $2.98 a cycle, bill the Iowa taxpayers $35 a cycle, are reimbursed a little over $26, and then they solicit from the very women that Ms. Fredrickson referred to as very low income, at or below poverty level, a $10 donation per cycle for each pill that goes out, each cycle of pills.
And that's clearly a distinct profit that most businesses would like to see in their margins. I'd like to turn again to Ms. Fredrickson, and I recall in your testimony you talked about the gap that would be created if we didn't fund Planned Parenthood. And would you say that there's no way to fill the gap of services that you testified, that there's not a way to fill that gap some other way?
We have evidence that it is nearly impossible, if not impossible, to fill that gap. The example from Texas and even in Louisiana, where they have tried to cut back on Planned Parenthood services and found that they could simply not serve the population that needed those services.
Then tell me, if you would, how did Planned Parenthood grow into this, quote, service, close quote, and into this gap that can't be created another way? Are you submitting then that free enterprise and demand and transportation and funding and resources wouldn't grow another entity or two or three or four or five that would fill the same demand that you're saying that Planned Parenthood only can fill?
With all due respect, sir, we are talking about Medicaid patients primarily who get these services, so no, I don't think they could be filled by the free enterprise system.
What do you think would happen?
Well, unfortunately, I think we'd have more unintended pregnancy and ultimately, unfortunately, more abortions.
I just suspect that the witness hasn't considered how this comes together, how free enterprise moves and accepts Medicaid checks, et cetera, how the clinic system works, how healthcare providers are able to take a look at the marketplace and supply a demand. And I suggest that that would be supplied without any great concern, and I would yield back.